So good morning everybody, and I would like to thank Dr. GVK and the scientific team for giving me this excellent opportunity. And we saw the causes of hypoglycemia and the pathophysiology. Now we see the consequences, the hypoglycemic clinical implications. You can see the acute consequences of hypoglycemia, symptomatic stress response. That is a very important thing. That's what everybody we have been talking in a different criteria. But a fall in glucose leads to immediately inhibition of insulin secretion, and your glucagon starts rising, and the stimulation of sympathetic nervous system and catecholamine response will be the first thing to be initiated, and later the growth hormone and the cortisol have been released. So symptoms, everybody talked, sweating, shaking, everything, and slowing of cognitive function is very important in this hypoglycemia. And you can see a lot of diabetic, long duration of diabetic, there will be a cognitive impairment will be there. It can be due to frequent episodes of hypoglycemia. And in people taking insulin, this stress response is deficient because, as already Dr. Pichimani told, the insulin and glucagon responses are absent in type 1 diabetes, and a variable impairment of rest of the response will be seen. So the impaired responses to subsequent hypoglycemia, recurrent hypoglycemia episode, what happens? Lowering of plasma glucose concentration. The first episode the patient would have experienced in 70, and in the next few episodes he will recognize only after the sugar goes below 50. So the glucose concentration still goes down, and sometimes below the level at which cognitive deterioration starts, leading to impaired awareness of the hypoglycemia. And impaired cognitive function, slowing of cerebration and performance, confusion and irrational behavior, and drowsiness to coma and seizure with possible employment, social and legal implications comes into the implications. And temporary focal deficit, there's a common thing, Todd's paresis, in which the person wakes after undetected nocturnal hypoglycemia with symptoms mimicking a stroke. And complete recovery is seen most of the time within hours, and there is no prognostic implications here. In animal studies of the extreme hypoglycemia, the hippocampus is particularly vulnerable. So impaired formation and consolidation of memory acutely impairs formation and consolidation of memory in type 1 diabetes. Cardiovascular effects, Dr. Pichimi told a lot of things about the cardiovascular effects. The acute effects include tachy and bradycardia, widened arterial pressure, and arrhythmias. And hypoglycemia produces endothelial dysfunction. That's one more important thing, because we see consistent hyperglycemia like 250 or 300, and highly variable hyperglycemia also has lot of deteriorations and lead to complications. But a single episode of hypoglycemia can have a lot of pathophysiological consequences which has to be taken care. And this endothelial dysfunction and inflammatory response and creates a coagulopathy which can last for several days with unknown long-term impact on cardiovascular. That's what I was telling. A single episode of hypoglycemia has a lot of cardiovascular consequences. And the mortality, death during an acute hypoglycemic episode is rare but occurs, accounting for up to 10% of deaths in the type 1 diabetics under the age of 40. And psychological impact, non-severe episodes usually with unpleasant symptoms and consequences like uninterrupted sleep, forced feeding and all, which may be distressing, but fear of hypoglycemia may develop in the patients or with the family members with negative impact of quality of life and glucose management strategies. So these are the pictorial depiction of hypoglycemia. And the cumulative effect, impact of hypoglycemia is societal impact may include loss of driving license and other things will be a problem. In many countries, this driving license is not being given for diabetics, and restricted employment, breakdown of family relationships, and restricted access to children, and stress levels may be high in partners. So economic impact, again, a single episode of hypoglycemia, treating that is very, very costly, and you have to investigate so deeply, and the hospital expenses and the medical costs goes high, including the time lost from the work. And impaired awareness of hypoglycemia, recurrent exposure to hypoglycemic episodes with evidence that avoidance of such exposure can restore awareness in some patients. So future mortality, severe hypoglycemia is estimated to be associated with increased future mortality risk of 50 to 600%, and severe hypoglycemia is also associated with a doubling in risk of subsequent cardiovascular events, including death, with bidirectional relationship. And said cognitive function, recurrent hypoglycemia in children may have a lasting impact on cognitive function. Their studies will be disturbed, and with a suspected but unproven impact in the adults also. A bidirectional relationship between dementia and hypoglycemia has been found in older adults. Thank you.